Ever wonder what your blood pressure is doing while you're fast asleep? For most healthy people, it actually takes a little dip. Think about it. Your body is at rest, so it makes sense, right? Typically, your blood pressure at night drops by about 10 to 20% compared to when you reawake and active. This nightly dip is a sign of a healthy cardiovascular system. But what happens when it doesn't drop? Or worse, it goes up? You might be thinking, how would I even know what my blood pressure is doing while I'm sleeping? You can't just wake up every hour to use a regular cuff. Well, you're right. There's a special technology for that called ambulatory blood pressure monitoring, or a BPM for short. It's a small, portable device you wear for 24 hours. It has a cuff on your arm and a small machine on a belt that automatically takes your blood pressure at regular intervals. Even while you sleep, this gives your doctor a complete picture of your blood pressure patterns throughout the day and night. And yes, in Canada, if your doctor thinks it's necessary, you can absolutely get this test through the medical system to investigate your blood pressure concerns. So, let's talk about the opposite scenario. What if your heart rate and blood pressure actually rise during sleep? It's a jarring experience to be woken up by a racing heart, and it can be really hard to fall back asleep. There are a few reasons this might happen. We can generally group them into two categories: people with occasional sleep disturbances and those with a regular sleep disorder. For someone with an occasional disturbance, it could be something as simple as a nightmare or even stress from the day carrying over into your sleep. Your brain can react to these stressors by triggering a fight-or-flight response, releasing adrenaline into your system. Adrenaline is a powerful hormone that instantly increases your heart rate, and as a result, your blood pressure shoots up. Think of it like your body's internal alarm system getting a false alarm. It wakes you up, heart pounding, ready for a threat that isn't really there. This can happen to anyone from time to time. However, if this is happening frequently, it could point towards a more serious underlying issue, like a sleep disorder. One of the most common culprits is sleep apnea. With sleep apnea, your breathing repeatedly stops and starts throughout the night. When your breathing stops, your oxygen levels drop. Your brain senses this danger and jolts you partially awake to resume breathing. This jolt often involves a surge of adrenaline. If this happens dozens or even hundreds of times a night, you're constantly flooding your system with stress hormones. This doesn't just disrupt your sleep. It keeps your heart rate and blood pressure elevated for long periods, which is a major strain on your cardiovascular system over time. So, when should you be concerned and see a doctor? Pay attention to the patterns. If you often feel your heart racing as you're trying to fall asleep, or if you frequently wake up with a hammering heart, it's time to have a chat with your doctor. It's especially important if these episodes are accompanied by other symptoms. Do you snore loudly? Does your partner say you gasp or choke in your sleep? Do you often wake up with a headache in the morning? Are you constantly tired during the day, no matter how much you think you've slept? These are all classic red flags for sleep apnea. Don't ignore them. Getting a proper diagnosis and treatment isn't just about getting a good night's sleep. It's about protecting your long-term heart health. Your sleep is incredibly important for your overall well-being. If something feels off, listen to your body. Seeking medical advice can provide answers and a path to better sleep and a healthier heart. Thanks for watching, and if you found this information helpful, please give us a like and subscribe for more health insights. Stay safe and sleep well.